Hello, my name is Jake Fratkin, and this is a short promotion of a lecture that I'm going to be doing for Eastern Currents on April 25th, 2015. This lecture is called Treating Infertility and Threatened Miscarriage with Chinese Herbal Medicine. Now, this lecture will be a 4-hour webinar, live webinar, and I'd like you to join us. And I want to just tell you a little bit about what we're going to do. You know that infertility is a big issue now, and I think that Chinese herbal medicine has a great contribution to make here. In my own practice, I have an 85% success rate or more, about 85%, with fertility in women under 39 without complications of fallopian destruction or polycystic ovaries. In normal cases, we have an 85% success rate without needing to use IVF. So this can save your patient a lot of money. The approach is herbal. The approach is very good. We'll mention some acupuncture protocols, but basically it's an herbal protocol that you can use with products that are already made, or better yet is if you can custom prescribe the herbs. So this will be on April 25th. I'm going to just give you a little bit of an overview of what we're going to do here. In Chinese medicine, infertility is either deficiency patterns or it's excess patterns. So the deficiency patterns would be either a blood and yin deficiency, or it would be a qi and yang deficiency. It's really a yin-yang imbalance. We'll talk about those patterns. The excess patterns, in Western medicine, deficiency patterns would account for no ovulation or irregular ovulation, small uterus, thin endometrium, poor quality of eggs or follicles, low estradiol or progesterone, and a high follicle-stimulating hormones, all of which inhibit fertility. In the excess patterns in TCM, we'll have first a stasis of qi, blood, or phlegm damp. In Western medicines, these will include fallopian tube blockages, uterine fibroids, ovarian cysts, endometriosis, adhesions, and stagnation due to emotional stress. In Chinese medicine, the excess patterns are stasis of qi, blood, or phlegm damp, or damp heat with heat toxins causing blood stasis. So in Western medicine, these are infections. We can treat these. The patterns in infertility, you can have irregular menses, early menses, and we will distinguish these early periods as excess patterns, excess heat, deficiency heat, or blood stasis patterns. We're going to talk about how to modify the foundation formula and then bleeding during ovulation. Irregular periods can also be delayed. These tend to be more the cold patterns. They could be excess cold patterns, deficiency cold patterns, blood deficiency patterns, or qi stagnation patterns. We have foundation formulas and then how to modify the foundation formula. And then there's irregular periods where they're sometimes early, sometimes late. These tend to be either liver qi stagnation patterns or kidney deficiency. Other cases that we'll look at is amenorrhea, modifying the foundation formulas and other amenorrhea syndromes, heavy uterine bleeding, dysfunctional uterine bleeding, and how to modify the formula, PMS, how this plays into infertility issues, dysmenorrhea, and polycystic ovarian syndrome. Then we'll talk about how to prevent a miscarriage once pregnancy is in place. The things that can cause a miscarriage is qi and blood deficiency, kidney qi deficiency, blood heat, or trauma. Now, generally, a lot of infertility is due to a progesterone deficiency. I'm going to talk about laboratory methods to check progesterone levels. I think that the blood spot tests are not as complete as saliva testing. The best testing is a 11 sample 30-day testing with saliva of progesterone levels, and a lot of times we'll see low progesterone. Acupuncture and herbal medicine can raise progesterone. Sometimes the combination of prescription progesterone plus Chinese herbal medicine will rectify the problem. Before I was recommending progesterone, I was still getting a very high success rate using Chinese herbs and acupuncture for infertility. So this is a big issue. We're going to talk about it. Please join me. I'll be looking forward to seeing you. I'll be looking forward to seeing you there. Thank you.